Do you think migraines are just really bad headaches? Think again. Today, we're diving deep into the world of migraines, a complex and often misunderstood condition that affects millions worldwide. Stay tuned to find out what truly sets migraines apart from ordinary headaches and how you can manage them more effectively. So, let's answer the big question. Are migraines and headaches the same thing? Absolutely not. Migraines are more than just severe headaches. While headaches are painful, migraines are a complex neurological condition that brings a range of other symptoms that can leave you completely incapacitated. A typical headache might cause discomfort, but a migraine can hit you with a storm of symptoms. We're talking about throbbing pain on one side of the head, sensitivity to light, sound, and even smells, nausea, and sometimes vomiting. It's not just a headache, it's a full body experience. Migraines can be triggered by a wide range of factors, which can vary from person to person. Understanding these triggers is crucial for managing and preventing migraines, as identifying and avoiding personal triggers can significantly reduce the frequency and severity of migraine attacks. Fluctuations in hormones are a key factor in triggering migraines, especially in women. The connection between hormones and migraines is most evident in the following stages of life. First, menstruation. Many women experience migraines around the time of their period, commonly referred to as menstrual migraines. This is due to the sharp drop in estrogen levels that occurs just before menstruation begins. Menstrual migraines tend to be more severe and last longer than other types of migraines. Second, pregnancy. During pregnancy, hormone levels fluctuate dramatically, especially in the first and third trimesters. Some women find that their migraines improve during pregnancy, while others may experience worsening symptoms. After childbirth, the sudden drop in hormone levels can also trigger migraines. Third, menopause. The hormonal changes leading up to menopause, perimenopause, can cause an increase in migraine frequency for some women. However, after menopause, when hormone levels stabilize, migraines often become less frequent and less severe. Hormone replacement therapy, HRT, sometimes used to manage menopausal symptoms, can also affect migraine patterns, either alleviating or worsening them depending on the individual. Next is dietary triggers. Certain foods and beverages are common migraine triggers due to their chemical makeup or effects on the brain's blood vessels. Some people are more sensitive to these triggers than others, and identifying food-related triggers often requires careful monitoring of diet and symptoms. Here are some common dietary triggers. First, aged cheeses. Foods like cheddar, blue cheese, and Parmesan contain high levels of tyramine, an amino acid that has been linked to migraines. Tyramine can affect blood pressure and may trigger headaches in sensitive individuals. Second, processed meats. Nitrates and nitrites, commonly found in processed meats like hot dogs, bacon, and deli meats, can cause blood vessels to dilate, which may trigger migraines. These preservatives are also believed to increase levels of nitric oxide in the bloodstream, a known migraine trigger. Third, caffeine. While caffeine in small amounts can sometimes relieve headaches, excessive or inconsistent caffeine consumption can be a problem for migraine sufferers. Caffeine withdrawal, often triggered when habitual caffeine drinkers reduce their intake, can result in intense headaches. On the flip side, consuming too much caffeine can overstimulate the nervous system, leading to migraines. Fourth, alcohol, especially red wine. Alcohol is a well-known migraine trigger, with red wine being particularly notorious. This is due to the presence of histamines and tannins, both of which can dilate blood vessels and trigger migraines. Some people may also be sensitive to the sulfites used as preservatives in wine and beer. Fifth, some other foods. Foods rich in MSG, monosodium glutamate, artificial sweeteners like aspartame, and pickled or fermented items can also be triggers. Chocolate is sometimes reported as a trigger, likely due to its caffeine content or other compounds that influence serotonin levels in the brain. Next on the list are lifestyle and environmental triggers beyond diet and hormones. Certain lifestyle and environmental factors are known to set off migraines. These factors can vary greatly between individuals, but common triggers include: first, stress. Emotional stress is one of the most common migraine triggers. During stressful situations, the brain releases certain chemicals that cause changes in the blood vessels, which can lead to a migraine. Interestingly, some people experience a let-down migraine after a stressful event, when their stress levels suddenly drop. Second, sleep patterns. Both too much and too little sleep can trigger migraines. Regular sleep schedules are essential, as changes in sleep patterns, such as jet lag, irregular shifts, or staying up late, can disrupt the body's internal clock and lead to a migraine. Additionally, conditions like sleep apnea may exacerbate migraines. Third, dehydration. Not drinking enough water can trigger migraines, as dehydration causes a reduction in blood volume, which in turn reduces the flow of oxygen and nutrients to the brain. Even mild dehydration can cause headaches, and for migraine sufferers, this can escalate into a full-blown attack. Fourth, weather changes. Sudden changes in weather, especially in terms of temperature, humidity, or barometric pressure, can act as triggers for migraines. For instance, a drop in barometric pressure before a storm can lead to dilation of blood vessels, causing migraines in susceptible individuals. High humidity and heat can also lead to dehydration, which can indirectly trigger migraines. Fifth, sensory stimuli. Bright lights, loud noises, and strong smells can all act as migraine triggers. Photophobia, sensitivity to light, is a hallmark of migraines, and bright, flickering lights can set off an attack. Loud environments, such as concerts or busy streets, and even certain smells, like perfumes, cleaning products, or cigarette smoke, can overwhelm the brain and initiate a migraine. Sixth, physical exertion. Intense physical activity, especially if it is sudden or unfamiliar, can trigger migraines for some individuals. This is particularly true for activities that involve straining, such as heavy lifting. Additionally, certain yoga poses or exercises that increase blood flow to the head can also lead to a migraine. How to identify personal triggers. Since triggers can vary so widely, keeping a migraine diary is often recommended as a way to pinpoint individual triggers. By recording details about food, activities, sleep patterns, and environmental factors, migraine sufferers can start to identify patterns and gain a better understanding of what leads to their attacks. This makes it easier to avoid specific triggers and to develop a personalized management plan. Identifying and managing these triggers can be an essential step in controlling migraines. While some triggers, like weather changes, may be unavoidable, many others, such as dietary factors, stress, and dehydration, can be controlled with careful attention to lifestyle choices. For individuals who experience frequent migraines, working closely with a healthcare provider to create a comprehensive management plan is crucial to finding relief and improving overall quality of life. And let's not forget the genetic factor. If migraines run in your family, there's a higher chance you might experience them too. Understanding your triggers is a crucial step in managing migraines. Migraines don't just happen out of nowhere. They often follow 4 stages, though not everyone goes through all of them. First is prodrome. This is the warning stage that can start hours or even days before the migraine hits. Symptoms here might include mood changes, neck stiffness, increased urination, or food cravings. Second is aura. Not everyone experiences this, but about a third of migraine sufferers do. During the aura phase, you might notice flashing lights, zigzag lines, or experience temporary vision loss. Some people feel a pins and needles sensation or have trouble speaking. Third is attack. This is the main event, where the throbbing headache occurs, usually on one side of the head. The pain can be severe and lasts anywhere from 4 to 72 hours. Along with the pain, there's often nausea, vomiting, and extreme sensitivity to light and sound. Fourth is postdrome. also known as the migraine hangover. After the headache subsides, you might feel drained, confused, or just out of it for a day or two. Diagnosing migraines can be more complex than it seems. Since many of their symptoms overlap with those of other conditions, healthcare providers must first exclude other potential causes, such as sinus infections, tension headaches, or, in rare cases, more severe conditions like brain tumors. While advanced imaging techniques like MRIs or CT scans may sometimes be needed, the key to an accurate diagnosis typically lies in the patient's detailed account of their symptoms. This includes describing the pain's location, intensity, duration, and any associated symptoms like nausea or light sensitivity. A thorough medical history is crucial for distinguishing migraines from other types of headaches. Moreover, tracking triggers such as stress, certain foods, or changes in sleep patterns can help doctors understand if the headache fits the profile of a migraine. This comprehensive approach allows for more accurate treatment, avoiding unnecessary interventions or misdiagnoses. Unfortunately, there's no universal cure for migraines, but there are plenty of treatment options that can make life much more manageable. Here are the main types of treatment. First, acute treatments. These focus on stopping or reducing the symptoms once a migraine begins. Over-the-counter pain relievers like ibuprofen or aspirin are common, but prescription meds like triptans, which block pain pathways in the brain, can also be effective. Second, preventive treatments. For individuals who suffer from frequent migraines, doctors might prescribe medications such as beta blockers, antidepressants, or anti-seizure drugs to help prevent or reduce the number of migraine episodes. These medications work in different ways. Beta blockers help relax blood vessels and reduce blood pressure, which can prevent migraines from being triggered. Antidepressants not only address mood, but also influence neurotransmitters, which play a role in pain perception. Anti-seizure medications help stabilize electrical activity in the brain, reducing the likelihood of migraine onset. In addition to medication, lifestyle changes are often recommended to further minimize migraine frequency. This might include stress management techniques, dietary adjustments, and maintaining regular sleep schedules. For some, a combination of medication and these preventive measures can significantly improve quality of life, reducing both the frequency and severity of migraine attacks. Third, newer treatments. Botox injections have been found to help those with chronic migraines by relaxing muscles and preventing pain signals from reaching the brain. There are also newer options like monoclonal antibodies that specifically target migraine pathways in the brain. While medications are important, one of the best ways to manage migraines is by preventing them. This means avoiding triggers, keeping a regular sleep schedule, staying hydrated, managing stress, and eating balanced meals can make a huge difference. For example, certain foods might trigger a migraine for some people, like chocolate, processed meats, or even citrus fruits. Tracking your symptoms in a migraine diary can be a game changer. You'll be able to identify patterns and understand what works best for you. Migraines may be a lifelong challenge, but with the right approach, many people can reduce the frequency and severity of their attacks. Whether it's through medication, lifestyle changes, or simply understanding your triggers, you can take control. Remember, migraines are tough, but you're tougher. With proper care, you can improve your quality of life and find relief. Wait, before you go, I've got a quick challenge for you. Ready? All right. If you've enjoyed this video even a little bit, here's what I need you to do. First, hit that like button. Not only does it let me know I'm on the right track, but it also pleases the mysterious YouTube algorithm, so they keep showing you content you actually enjoy. And if you've got thoughts, ideas, or even a random fact you learned today, drop it in the comments below. I love reading them, and who knows, your comment might inspire my next video. Plus, it helps keep the conversation going. We're all in this together after all. Finally, that big red button? Yeah, the subscribe one. Tap it, smash it, just don't ignore it. Because trust me, you don't want to miss what's coming next. And hey, don't forget to ring that bell. It's like having VIP access. You'll get notified the moment I drop a new video. Thanks for watching. You're awesome. See you in the next one.